Hi.
Welcome to Vitals and Values, where we talk about science over hype and we talk about values over virality. And what are you giggling about over there?
In full transparency, this is round 2 of this episode because I didn't
Someone.
check to make sure my mic was doing what it was supposed to be doing.
We did already record this whole episode, and when David went to edit it, he couldn't hear himself.
I had no voice.
That's never happened to you before, has it?
That was a first. Usually I stay on top of making sure it all makes sense and we're on the same page, but
We're going to do round two. It's going to be even better.
perfection's a myth, progress is the goal.
So this episode is coming out slightly late due to our
Whoopsies.
Okay, but this is a great conversation and we can have it again. So we are talking about patient expectations and physician realities and how those align or don't.
And I love the ChatGPT helping with the potential name of this. I think it's pretty forthright of it because I think especially with this, the conversation is primarily gonna be around the expectations of the traditional healthcare system.
Correct.
And so, like, throughout this episode, it's going to be, hey, I think it's super important. Towards the end, I know you're going to be giving helpful tips that if you're in the traditional healthcare system with insurance and you got 12 minutes, 15 minutes, how can you effectively use your time with your doctor as efficiently as possible? But it comes down to the idea of patients want time, doctors don't have it.
And so this is not, I mean, we're trying to give the reality of this. We know that doctors are in a hard situation and patients are in a hard situation, and neither of them are perfect. Doctors make mistakes. Patients have sometimes unrealistic expectations, but it goes both ways. And so this is not to, we're not trying to diss on any one of those groups.
But just the harsh reality check. Like, let's talk about both sides of the aisle and how to be practical.
I've obviously worked on both. Well, I've obviously worked in the traditional system. I'm now not in the traditional system. You've been a patient. Your experience is actually, as you say, sunshine and roses.
Sunshine and rainbows.
Oh, rainbows, excuse me.
And the unique perspective of seeing my father go from being on the physician side to retiring. Because don't kid yourself, when you're on the physician side,
You get some perks.
you get perks just like anything else. Like you have to see a doctor and you say, hey, I'm Dr. Roden. And guess what? You go from being in a 3-month waiting period to, oh, I'll see you next week. I'll squeeze you in.
Well, because people know you and you have a reputation, and it makes sense.
It's just like in any industry. Like you're in the restaurant industry, and some owner of another restaurant comes in, and there's no available seating. Don't kid yourself. I'm sure they all, oh yeah, I'll find you a spot.
Or you're not in the restaurant industry and you're someone like David who just happens to be friendly. So we went out for breakfast last week, and the restaurant owner you met one time
on the golf course.
And there was an hour and 45-minute wait for this restaurant for brunch. And we got sat down in 20 minutes.
Absolutely. Shout out to Brunch House.
Absolutely.
On Forest Hills.
So good.
It was delicious. First time going there. And actually that was super funny because we practiced what we preach people. Now we're on a tangent here, but that's okay. We, just like the event last night, when it comes to muscle, it's a long-term affair. When it comes to health, it's a long-term affair. Mm-hmm. And me, mom, and you sat down for brunch, and we all had some eggs, lean protein, some fruit cups, and then we all split the pancakes.
A great way to go.
I remember the waitress goes, "Oh, you guys are all eating healthy."
She did say that. I was like, "Is that have to be a shocking thing?" It's kind of sad, isn't it?
But yeah. But shout out to Brunch House. It was delicious. Highly recommend.
Yep. So you're in Ada area of Michigan, check it out. But do you want to start then with that?
That was an unpaid thing. There was no paid promotion.
But we will go back. I was saying, do you want to start with that story of what your dad has been experiencing?
Yeah, I mean, because it's so funny because he's so used to playing the doctor card and then jumping through the 3 gatekeepers to get to who he needs to get to. And now watching him suffer on a 30-minute like waiting tree to get something done, like he's got a lot of patience. He has a hard time dealing with it.
But so he's trying to get records from one doctor to a different doctor.
Yep.
And it's like pulling his hair, correct?
Yeah, and it's in like the people. it's the classic. The people working the system are just reading off a teleprompter. They're not really well taught. I'm sure there's big churn in whatever system they're using. And so just like so many things have gone too much into the SOPs and this is how you do things, no one's actually taught anything. And so like you have your little lane, and if you don't fit that exact mold, oh, let me jump into this other person.
No
And
one
then
wants
you're
to go
jumping
above
into
and beyond. We have
it's
seen
super funny.
that.
But yeah, he's been suffering through these 30-minute waiting tree calls to try to get one thing done. And it's been mom's just like, I've been doing this for years. I don't know what yours so special. Like this is you just put the phone on speakerphone and you just sit in the waiting tree and it'll come up when and dad's like, what do you mean? Like this is
He's
how
like,
normal
I
people.
expect people to do stuff when I talk, and he's not getting that
No, no.
because he's not Dr. Roden right now. He is patient
He's patient.
Roden.
And funny enough, when you come from the big systems, when you're in the big system and you're in a position of power, like that plays. But as soon as you retire, you are a nobody again.
I believe it.
And he
That
was,
identity is lost.
it's like going back to the documentary when we were looking to do a spot to do the interview for Dr. Nadolsky. We were struggling because we wanted that medical vibe. So Dr. Nadolsky was flying in from like South Carolina. He was going to be out for like just one weekend. He hadn't moved to Michigan yet. And so we had a very fixed time to get this done. And I remember literally, so I was working on it for like 2 weeks straight trying to get us a medical building to record this episode or the his interview with, and we were just getting stonewalled at every turn because guess what? Every medical system nowadays is all owned by the big three. And don't kid yourself, a doctor can't make that call. And now if we had concierge medicine of West Michigan, we definitely could have done it here. It'd have been great. But like, so we were just fighting back and forth trying to find something. I remember teasing Dad. I'm like, Dad, if you were still working, could we just went to West Michigan Heart and just done it? He's like, absolutely. We could have just taken a room and what a big deal. But he goes, now do I have that influence? No, no. I would like they would have just laughed at me.
I think these are all very much more unique experiences than like the normal person has at the doctor's office, but it gives you the same idea of
Yeah,
patients have these certain things that they expect from going to see their doctor, and they do not feel like they get it in the end.
absolutely. As we start off that massive tangent, why do most people assume doctor's visits should include like a full workup, labs, and answering every question? Because I think that's the people think the average person thinks that okay, I have these 5 things I'm struggling with, and they expect in a 12 to 15-minute sit down they're going to hit every one of these 12 things. How does that kind of
And
unpack
I
that?
don't know where that like started from, but I mean, most people will at least go to the doctor once a year for their physical. And I think for a lot of patients, their expectation of a physical is I want to talk about my concerns. And the medical system's perspective of what a physical is specific screening recommendations that we have to make sure you get through, guidelines on preventative care and those types of things. But that is not the same thing as going through someone's problems. And so the patient comes in expecting one thing, the doctor is set up to do another thing. And so there's only maybe 15 minutes they have with the doctor, and you cannot address both of those things at the same time. And so the patient leaves feeling unheard or like their questions weren't answered, and the doctor feels like they are rushing and not doing a good job, and really they're frustrated as well. And I don't know how we got to this point. I think some of it has to do with the fact that patients have more and more questions and problems, and whether that be from the health of our nation. And I think the access to information online where people start reading lots of different things. And so they have a lot more questions. But it is a struggle on both sides.
Yeah. And then I mean, this is putting on the harsh reality hat, people. Coming from a person who was pre-diabetic, high blood pressure, morbidly obese by the time he was 15, 16, 17 years old. I know from my point of view, what the expectation of a physician is, they don't have this. The system was not designed to have the amount of chronic diseases the average American has and to have every single one of those unpacked, treated, and dealt with, it just wasn't designed for it. And it's like a harsh reality check. The average American's general health is in such a nasty disarray of we eat too much fast food, we sit too much, we don't prioritize whole foods and fiber, we're eating too many calories, we're drinking too much alcohol, even though alcohol is on the way down, which is super cool. And all this kind of stuff. And the reality is the average American needs to take more accountability for their general lifestyle, because so many of these chronic diseases that people are dealing with are primarily lifestyle driven. And so it's, you can definitely see from the physician's lens, it was not designed for this, for such a, like, yes, elderly people get diabetes. Elderly people are dealing with all these things because they can't do what they could do in their 30s and 40s and all this kind of stuff. But when you're seeing 15-year-old kids coming in with pre-diabetes and dangerously high blood pressure, and they're 180 pounds overweight, we got to take some personal accountability from the patient side. And I know people want to lean in on blame the doctor, but the system's just not designed for that.
I know that not all doctors are good at listening and not all doctors do what patients want and not all doctors are good, but you, I think, have to remember that they are within a system that is not set up for anyone to succeed, in my opinion. It just does not work.
Okay, so as we kind of transition to the physician's lens, you got traditional education or traditional medicine where you're insurance based and you get 15 minutes because that's what insurance is going to pay for, basically. What are your primary goals in a 15-minute sit down?
And a 15-minute, when you have a limited time with patients, you have to talk to them about the things that you think are likely to cause the most harm. So you really have to focus on those things. And the problem is not patients aren't always worried about those things. So, for example, blood pressure is a huge problem. Lots of people have high blood pressure. It leads to so many issues and leads to a lot of mortality. And many patients are not worried about their blood pressure. But when
Because
someone
I don't feel my blood.
'cause you,
Actually, on a tangent for bringing this up, I've never confirmed this, but I
yeah,
can
right.
tell.
I know.
Dad hates this, and Lara hates this as well. I can tell my blood pressure is elevated because I can feel the pulsating in my ears.
Sure, he can. Yeah, but he never actually wants to test this. I think he's afraid he's wrong.
I can feel it because that's actually the opposite side. It's like you can't feel blood pressure.
No, I mean, elevated blood pressure is not a symptomatic thing typically. I mean, when it gets super high, it can be, yes. But a lot of people are running with blood pressures in the 150s, 160s, which is not good, but they cannot feel that. And so they don't want to talk about their blood pressure. They want to talk about their knee pain or whatever it may be. But from a physician lens, wow, we really need to care about this blood pressure issue. And the patient is unhappy at the end because all the doctor did was focus on their blood pressure and didn't listen to them about the knee. And so it's a challenging situation because the doctor has to care about the blood pressure. And the patient, I think, should care about the blood pressure, but the doctor doesn't always have time to explain to them why they should care about it or convince them in 5 minutes. And so, again, it's just another example of how it's just, I feel like everyone is set up for failure.
That's Debbie Downer, but yeah, I get it.
Oh, sorry.
No, you're
Is that
good.
too depressing?
It's different. I mean, again, it's. I would agree that the current system is not designed for the relationship side of how this collaborative effort is going to be. And that's why I talked about it before. I think it's important to bring it up again, where it's like one of the things that I would love to see inside the traditional primary care world is more of a celebration towards, but HIPAA has a hard time like allowing this, where in every other industry where they don't have these huge legal like jumps they have to go through, where it's like weight loss and fitness coaches, for example, they can do whatever the frick they want. Like they can post about their success stories. I don't think there's no HIPAA for like a weight loss coach and celebrating some of their clients and all this kind of stuff. And why is it that some random dude or chick on the internet can help hundreds, if not thousands of people drop 30, 40, 50, 80 pounds because of that weight loss? Their blood pressure gets better, their A1C gets better, all this stuff gets better. And why is it that doctors who have all of the resources, all of the knowledge, have such poor, consistent outcomes in success of helping people get actually better health is because it's so compartmentalized. No one's creating a standard practice where, hey, when you come into this practice, we have this is what we do. You're going to lose the weight. You're going to do this. This is how because we have such success stories. There's no wall of like, look at this, all these people who got off their medications by doing these things because Hippo, to a degree, won't
All right.
allow it.
But I argue
Mhm.
that one of the issues too is that everyone goes to a doctor,
Mhm.
whether they want those results or not. So when you're a weight loss coach or a trainer or whatever, a fitness person, people are coming to you because they want the result. But not everyone comes to the doctor actually wanting the result that the doctor would want. And so there's a selection bias. Whether or not you're going to follow at all what the doctor says, you're still going to go see one.
We have a family friend. She smoked her whole life,
Uh-huh.
still smokes cigarettes to this day. And she will literally go to her primary 2 to 3 times a year and says to the primary consistently, I'm not going to stop smoking cigarettes, but I want you to give me every test and everything to help me not get cancer. It's the funniest thing in the
Well, at
world.
least she's accepting the fact like this, I'm not going to do it. So what else can we do? She's not lying to herself.
It's so funny.
I always appreciate those kind of patients. And I'm like, hey, do you think you would do this? And they're like, no, I'm not going to do that. Like I had a patient the other week, and I was like, well, he wanted to work on more. He wanted to lift weights. I'm like, well, would you get a gym membership? Would you? Like, no, I wouldn't. I'm not going to use it. I'm like, okay, so now I know which, like, we can't talk about, hey, maybe you should try this gym or that gym. Like, it doesn't matter. He's not going to do it.
Mhm.
So we have to go a different route and kind of be more creative.
Yeah.
You
Well,
gotta listen.
well, that's being honest. Gosh, it's always a hard one. It's like, I mean, I was the exact opposite, and I think a lot of people will realize that we lie to ourselves and lie to our doctors on what we will or will not do.
You lied to your doctor.
I lie to my dentist every time I see her.
Why?
I do not floss every day.
Why do
I
you
do
tell her
floss.
that?
I do floss. I do not floss every day. She asks,
Why?
I'm just because I don't want to deal with it. I'm just going to say I floss every day. I don't floss every day. But
Dr. Dial? Hope
Dr.
she's
Dial,
not listening. David's not flossing.
as they're in your mouth, how's your day going?
But see, I know. Okay, I don't understand it. Like people do that all the time, and I'm like, why do you lie? Just tell them the truth. Just own it.
Because I don't want to do a conflict. I don't want you mad at. I don't want my doctor mad at me.
Oh, poor David. I'd say just be true to your doctor and be like, yep, that's me. That's what it is.
Yeah,
It is what it is.
no, that's very
We're
true.
gonna come back to this in like 6 months and see if David has changed what he talks to Dr. Dial about.
Nope.
All right, yes. So what a physician is expected to accomplish in 10 to 15 minutes is unreasonable. And so if you are a patient out there and you're frustrated with your physician not listening to all your concerns at a visit, I would suggest you pare down your list and make more visits and really focus on one thing at your visit. One, maybe two things
How
at
does
each.
that work?
In what sense?
I know the status quo is like 2 visits a year with a primary. That's kind of like the status quo.
According to who?
I'm just saying in general, when you think about what people tend to do,
Well, that may be what people tend to do.
that's why I bring it up.
Okay.
What is the actual? Because obviously you're paying a copay
Uh-huh.
to go see a primary
Well, it
in
depends
the
on what your
tradition.
insurance is.
Exactly. Uh, but like, okay, so maybe copay, maybe not. You're not in the concierge model where you can come in as much as you want with and just kind of lean in on what you need. How does that work? Obviously, it's just scheduling,
Yeah.
but realistically, if you were to like go to your primary and be like, I want to spend as much time with you, and I understand I have to pay a $40 copay every time. How many times do you think you can actually get in a year?
I have, because there's a lot of patients that come in for, say, anxiety and depression, right?
Mhm.
And when you start many of the SSRIs or other types of medications that we typically would prescribe for something like that, those medications take about 4 to 6 weeks to start working. So it's very, very, very common to start someone on that med, see them back in 6 weeks. And if they're not doing well at 6 weeks and you have to switch something, you see them back in 6 weeks. So you can see people back like that. People just tend to stop coming or they don't want to come.
Well, and that's the angle to me. I was just I to be honest, this is off script. It just started leaning in on this, and I go, what stops somebody? I understand because of insurance, because of this game, you get 10 to 15 minutes. But what stops somebody from saying, I'm going to come in once a month?
I mean, I think
It's scheduling.
some people have
It's
a
like
hard
what
time
is
with their getting on. Like some people have a hard time
yeah,
because they work, let's
yeah,
say. Some people like are like, I don't want to be. There's some people that just don't want to.
yeah.
There are people that don't want to pay so many copays because they're like, every time I come here, I have to pay $20 or whatever it is, and they don't like that. I think some people get frustrated and think, well, this isn't working, so they stop coming, which defeats the purpose because then nothing changes. But so there's a lot of different reasons.
Because I just started leaning in on that. I'm like, okay, I understand everyone feels like a number, and you only getting 15 minutes, and like the status quo from my point of view is like, yeah, you see your primary twice a year.
That's so funny that you say that. That's not in my mind what the status quo is.
What do you see?
Well, I mean, I know there's once a year people come in for their physical.
Yeah.
And beyond that, it depends on what you're dealing with. So people with diabetes will often come in 4 times a year. People with high blood pressure may come in twice a year if it's controlled. But if people have uncontrolled issues, they come in multiple times a year. And if you're completely healthy, you might come in just that once a year.
Yeah.
So it's
Or
really totally dependent.
in my way, last time I saw my primary was 4 years ago.
I thought you saw him not that long
Oh,
ago.
I did up
Oh,
until that
oh,
point. And he was like, David, I know you're healthy. I know everything's great. Can we make it like bi-yearly instead of every 4 years?
well, a lot of offices, like at least where I used to work, if you haven't been seen in 3 years, you're not a patient anymore.
Yeah. And I just remember looking at him like, hey, man, my A1C is 4.2. My LDL is 69. I don't want to hear it.
He was like, I'm too good for you.
I'm just too healthy and good looking to come in here more than that. I know you want to see me more, but I'm kind of a big deal over here.
Yeah, so what makes
Kind of healthy as an ox.
so you don't go in just because you don't think like, it's necessary.
Correct.
And I think that is why a lot
But
of people
then,
don't go in.
and that's why I was thinking the opposite side though, was like if someone feels like a number
Uh,
and unheard, but they still only do once a year or twice a year. Well, I was actually no, I really was like, okay, now mind you, I'm just sitting there going, in the traditional world today, because you have 3,000 patients and you're backlogged 3 months. So like, how many times can you realistically
So
set
the
up
thing is, I mean,
appointments?
how they set it up. So if you're in the office and you need a follow-up in 4 to 6 weeks,
Hmm.
you can usually get that scheduled. If you call in and want an appointment for something non-acute, they're going to push you out to the end. That's where you get
God,
a 3 month time frame. But they have these like they have their
buffered in.
schedules where there's like appointments that are being held essentially. At least this is how I have experienced it. I'm sure it's different wherever you go. But there's certain appointments that are kind of held for more acute issues. And so they leave things open. But if you're calling for your physical and you want it tomorrow, they're not going to get you in tomorrow because that is not urgent. You may
Gotcha.
think it's urgent as a person, but the doctor's office does not think that's urgent.
Gotcha. Okay. So that's very interesting 'cause I don't know. I've always seen that, especially a lot of people when they see their doctor once every 6 months, once a year, and they're feeling unheard.
Like, why didn't you go
What's
back?
yeah, what stops you from just doing it more? Am I missing something? Obviously, there's copays and there's scheduling,
When I think some
but
people like seem to expect that they can get through what they need to in one visit. And then I think some people think, well, it's only a 1 time a year thing, so I have to do it all now. And then doesn't become good. That's not reality.
hmm, yeah, they're just
I mean,
literally,
that's my perspective, but hey, if there's patients out there, right.
but then also get frustrated
Yeah.
by the status
Well,
quo.
that's what I mean. I had so many patients that would come in for their physical once a year. They'd come in with their list of back pain, weight gain, whatever it was. And I'd be like, well, we talked about this all last year. Did you do any of those things that we talked about with your nutrition, with your exercise? I mean, no. I mean, maybe they'd done it for 2 weeks, but you don't see them back for a year. So then they're still upset. They're kind of irritated because they still have the same problem.
Yeah, because you're the bad doctor.
I know. And so, uh,
That's why your
there's like losing
satisfaction
battles.
scores are bad.
Yeah, exactly.
Speaking of satisfaction scores,
No, I don't like them. If that's what you were going to ask.
why?
Well, because most of the time it seemed that it was from unhappy, disgruntled patients who just had a chip on their shoulder. I mean, if you could get every single patient to give a true review, that'd be great. But that's not the reality.
I still love the Google review.
Yes, there is a Google review out there. Don't go search for it, people. For when I worked at the my prior office, that said something like, Dr. Bomberg killed my sister, literally in bold or all caps, and exclamation marks. And then it goes into some
The big
story
story.
about what I did. I don't even remember how it didn't even make sense to me. And I don't think it was me. Like, I don't think any of this had to do with me. I think this was somebody else. I didn't kill anybody's sister. I'm just gonna put that
Just
out there.
Google reviews and stuff is so fascinating because it's like anyone can say anything about anybody.
And it's stuck on the internet forever.
I'm actually starting to see this trend, which is nasty.
Or
This just literally came up today. It's happening to Dr. Allo. It's happening to a bunch of other people where because they're big social media guys and girls talking about medicine and the reality and trying to debunk all this diet culture and all this a lot of this Maha stuff and all these just bad literature and debunking it. Now there's this new play where all these people on the internet are going on people's doctors' Google reviews and stuff and just leaving horrible reviews.
and they've never even met the person.
Never met the person.
That's so
And
bad.
now they're just dumping them with negative reviews because
Is
they
Google gonna
can.
do anything about
I'm very
that?
intrigued that this literally just happened. I've just been seeing
Huh.
this trend start now.
I'm surprised that hasn't happened before now that you
Before,
say
yeah, but
that.
it's like the whole doxing, and you got this, and you got this, and like this is the new one, which is like here are these doctors who they don't get. I mean, don't kid yourself. When you create a big, who is I? Some doctor that I don't think I followed, but she popped up on my one of my social medias. I can't remember what specialty she was, but she just made the comment, "I now make more money doing social media than I do as a physician, and I don't know what to do."
It's
And
crazy.
like, do I stay as a physician and keep
Uh-huh.
doing what I'm doing, or do I just lean in on social
Funny.
media and make more
Huh.
money? But just that whole thing of there's plenty of doctors that are on social media accounts that their only desire is to have you be as healthy as possible and debunk so much of this bad information out there because it's truly harming people. Like when these carnivore doctors and these people say LDL cholesterol doesn't matter for heart disease, it's the most unbacked. It just there's nothing to support it at all. But there's a couple carnivore doctors that'll say it does, like it's blah, 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 and like they'll give you bad studies or non-comparative studies, and it's like, and so these doctors come out here and I actually care about your health, and so let me debunk that, and that's what these doctors do. But they have full-time incomes and full-time jobs. Like I don't know how Dr. Allo does it. Dr. Allo he's a board certified cardiologist. I think he's intervention, but I'm not 100% there. He does all of his social media posting. He does personal training stuff. He does books. He does he must not sleep. I don't know how
You
he
have a
does it.
team that works for him?
I don't get the vibe.
Have you talked to him?
We talk occasionally. I've never asked how much like
Well,
help he
Dr.
gets.
L, let us know.
Yeah, I'm gonna have to ask him because
How do
it's
you do
impressive.
it?
It's impressive.
You're for anyone listening, Dr. Allo is somebody they should follow, you're
Yes,
saying?
Dr.
Okay,
Al is
great.
awesome. Board certified cardiologist. I think he lives in Ohio.
I feel like you mentioned that.
Yeah.
Okay.
And really good guy. And we talk on social media on occasion. And yeah, but but again, it's just so fascinating to me with this new trend of basically taking these doctors who are debunking bad science and now Google reviews are being littered with just nonsense. It's like,
Yeah, I mean, I mean, there's benefit in reviews, but I think there's so much skewed information
mhm.
that it just becomes not helpful. Because I mean, in my prior job, we would get our reviews, like, I don't know, they were just handed to us at some point in time. I don't know how they decided. I don't know if it was once a month. I truly don't know. And then the patients would give you numbers too. And so then your number score like went into what they called your scorecard. And your scorecard, there's all these components, and that's how you got paid. And so if people read bad reviews, it impacted your pay. I mean, I don't know how much because I don't know how they figured that out. But so if someone's just mad at you for an unrealistic reason,
Do you
it doesn't
have any of
matter.
those?
Huh? Oh,
You do have a funny story.
yeah, the guy, so not a patient of mine. He was a partner's patient, but needed to be seen for he couldn't hear out of one of his ears. It's not an uncommon concern. Many people have wax buildup in their ears. They need to flush it out with water, and they're fine. They can hear again. So I got to see him, and those are always great visits when they got put in your schedule because you're like, this will be fast, it'll be easy, I can catch up on something else. So I went in to see the guy, looked in his ear. Yep, he had wax in there. Got my medical assistant in the room to clean out his ear because that is their job. Medical assistants are the ones that clean out the ears, not the doctors. And then, so she did a great job. I went in there, re-looked in his ear. Yep, it was all clean. I was like, thanks. Have a good day. And then the next time I got my reviews back, there was one there that was obviously from him because he was not happy that I had spent so little time in the room with him. And it was ridiculous that I had sent in my like underling to take care of the problem. So he was all ticked about that visit. I'm like, what on earth did you expect? Like, did you want me to personally clean out your ear? Like, who cares who cleans out your ear? I don't clean out ears, so you probably don't want me to do it. I probably wouldn't do a very good job.
Yeah,
And so that's the kind of stuff like I would get dinged for something like that.
and then somehow that type of, and then I hate to say it, a lot of your superiors are not medical backed. They're just admins. And then here they are taking this. There's no discernment. It's like to think that that is going to affect your pay when you're just doing your job based upon status quo. It's like I understand the importance because we're doing it right now within Concierge Medicine of West Michigan. Is like I'm creating a survey right now to help because it's
Because
important.
feedback is good.
Feedback's
I'm
great.
not saying I don't like feedback. I think feedback is awesome and I want positive and I want negative. But when it's done in the way it is in the medical system, I just don't think I think it's skewed.
Yeah. Yeah, because in general, unless you incentivize across the board, people that have good experiences don't communicate it, and people who have bad experiences love to just
Right.
hammer on it.
And the thing is, even if a patient had a bad experience, their doctor may have been doing a great job.
Yeah,
Like
they
just
just didn't like
because
it.
they just didn't like it, just because if you go into your doctor and you want something, your doctor says no, that does not make them a bad doctor. It could, but it doesn't necessarily. Like they may have a very clear reason that they don't want to do what you want.
Yep. My great example of that, and this is coming from someone who lived it. We have this weird notion now, and again, there is a context there where there's this whole new trend of people like taking cards to their doctors, like, or at least for a while there was, on they're triggered by their weight.
Oh,
So
yeah.
I don't want you to weigh me
Uh-huh.
unless it has a direct effect, blah, 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 blah. And it's like the amount of people are like, doctors are just fat phobic because all they talk about is weight loss. Well, obesity and being considerably overweight pretty much harms every organ system. And so the amount of people, I'm so sick of my doctor talking about my weight. Well, I hate to break it to you. It's one of the most alarming health concerns that affects a lot of your other
Yeah.
problems that we need to hammer. And if you don't like that, that's just it's just
Well, I
science.
know,
Like I'm sorry.
like how I get that people don't like that to be the answer every time, but I'm also like it's reality that that is impacting your health. It's
Hmm.
impacting your blood sugar, it's impacting your blood pressure, it's impacting your knee pain and your back pain and all those things. And so if your doctor doesn't comment on it, don't you think they're missing something? Like I don't know what they want to hear.
You know,
I truly don't. Like we can't change the reality of how our bodies work.
well, I think it kind of goes into diving into that balance of telling what patients need to hear, or want to hear, what they want to focus on versus what they need to focus on. And how do you balance that
Yeah.
in 15 minutes is a
Tough.
dumpster
Yeah.
fire. And then kind of transitioning, how has that experience been going from knowing you have 15 minutes, go, go,
Hmm.
go, to up to 90 minutes
Hmm.
now in concierge? Have you experienced uh, depth with patients in a way that you have never experienced
Yeah.
before and what that's been like?
Well, I think because in you can get depth with a patient in the traditional system, but it takes years because you have to see them repetitively to learn so much about them. But in our concierge practice, I feel like in the first visit, I get as much as I might have in 5 years with a prior patient because you're able to talk about so much. And what was your first question?
Well, just the idea of like how has that transition been from like when you had 15
Yeah.
minutes and how you focused on it versus now having upwards of 90 minutes with a single patient? How has that been?
I think when you have 15 minutes, like as a physician, if there are things that are going to harm your patient, you cannot not say them. And so that's where patients feel like they're not heard sometimes. I think, like I kind of talked about at the beginning, but in our concierge practice, it's easy to talk about the thing that I think, hey, this is concerning, but then we still got another 45, 50 minutes to talk about what they want. And so they leave feeling heard because they are truly. And so you're able to do it in that one visit in our concierge practice, whereas in a traditional system, you can't get that with your doctor if you go see them more.
Gotcha.
So, did I answer your question?
Yeah, 100%. And then I guess as we kind of wrap this up, for someone who's still in the traditional system and they know they have 15 minutes, walk me through what is the best way to make sure that they have the best experience with their physician they can have.
They go in with not too many problems. So take your top one or two and go in with the expectation to cover those two things well. Because if you want to cover 8 things in 15 minutes, you're going to be the person that gets a med thrown at you or a referral thrown at you or something like that, because that's all the doctor really has time for. So make your top two and be okay with that. You can see the doctor again. That's just reality. So do that, and then have your information. So if you have records or you have your medications, like go in knowing what those things are. If you have documentation, if you can bring in paperwork, like be ready so that you're not fumbling through trying to remember things, because that takes time. So just be prepared. And then, I mean, give information, like give the history. Your doctor needs to know your story, but don't go on too many tangents because that just takes up too much time. So I just think knowing those things is going to make it easier for you.
100%. Well, hopefully learning some expectations versus reality and is helpful for everyone watching and listening, because number one, in the just the traditional game, you get 15 minutes. So being efficient with it. And I just had the aha moment. It's okay to go more consistent if you need it.
If you need it, you go more than once a year.
Go more once a year.
That's a good place to end it. So
Well, hey, it was an honor and privilege. If you guys have any topics you guys would like us to cover, more than welcome to DM us. We've been getting a couple recently myself. People have been DMing me about different stuff to run over. We appreciate it. And you guys all have a phenomenal day.
awesome. Bye.
Bye.